evening, everyone. Welcome to Open Forum. Can I get a show of hands for who is new to Open Forum? All right. Wow, that's a record number. Well, my name is Dr. Hunter Peterson. I'm a naturopathic physician and the clinic director of Coeur d'Alene Healing Arts. We have a clinic in downtown Coeur d'Alene, and this forum is something we established a few years ago as a monthly dialogue, I like to call it, where we talk about all topics health. So, as you all saw in the clinic's the Pilgrim's advertisement, I'm going to be speaking about autoimmune disease today as a topic, but I also want to provide an opportunity to dialogue about any health topic. So one of the things we'll do is, before I dive into that lecture, leave a little space for each of you to voice any question you'd like to speak on. So give me just a second, I want to give a couple more announcements. We're recording this on a video, and so if you want to re-listen to it or show it to a friend, it's going to be on our website, hopefully in the next week. If you want to learn a little more about our clinic, our website's a great place. We have a couple of flyers in the back. And we like to do a lot of community-oriented events. And so I have a little sign-in sheet. If you want to be on our listserv and hear about what we're doing, detoxes, classes, distribution of articles, newsletters, this would be a good place to let us know. So I'm going to pass that around. And as I said, before we dive into the topic, I'd like to open the floor to everyone to bring in whatever questions you'd like to talk about following the lecture. Yes?
I have lupus.
Okay.
And I am on medications with a doctor. Can one be on naturopathic remedies along with their medical prescriptions?
Great. I'm not going to add that as a topic because I'll cover that in the lecture.
Okay.
But absolutely, I'll make sure to address that. Yeah, what else? Yes?
So I was diagnosed with lupus 3 years ago. So I've never taken any medications. I always use supplements. One of the questions is there a lot of fatigue with it? So even when the supplements don't work, what else can you do so that you're not so tired of fatigue?
Yeah. So fatigue. And just to reiterate, these are great questions, but any topic whatsoever, any type relating to health, we're opening the floor so that if we want to tackle these at the end of the lecture. Any others? Yeah.
What is autoimmune? What is the definition of it?
We'll get into that.
Oh, okay.
Yeah, we're coming to it.
I don't know what I want to ask until after I've heard what
Sure.
you said.
Yeah. Historically, we have some of those people who aren't new love to ask a lot of questions, and so it's okay to not have a bunch. I'm not putting you on the spot, but just wanted to leave that space in case there were any topics that anyone wanted to touch base on. So if there's not, we'll get started.
Just fatigue is related, I think, to my situation with thyroid.
Okay.
But I have, I'm hypo. My sister is hyper. How does that happen? I mean, like, it's totally opposite, right?
Yeah.
I mean, that's.
Sure. Yeah, I can talk about thyroid disease and cause. Sure. Yes.
Touch on Raynaud's or however you say it.
Mm-hmm. Yeah. What about Raynaud's would you like to learn about?
I already feel like with my extremities, like it's barely cold and they're hurting and getting white.
Yeah.
So is there anything you do?
Yeah. How to treat it. Yes, in the back.
You may be already touching on this in your lecture, but I'd like you to for sure cover adrenal fatigue and how it relates to autoimmune disease.
Okay.
What comes first?
Sure.
And how to overcome it, of course.
Yeah. Great. What other topics, questions, thoughts? Yes.
I don't know that it has anything to do with what you're talking about today, but I'm going through a process now with doctors and MRIs and blah. I was in a car accident 45 years ago, and suddenly the pain, the nerve pain, the damage is just blasting me. And I don't know if that has anything to do with, it was an accident a long time ago, but I don't want surgery. So I'm kind of looking for what else might be available to give me some relief. I know it's not going to solve the problem. Well,
Sure.
I don't presume it's not, but
Yeah. So nerve pain,
yeah.
region specific.
Neck and arm. It's moved. It was always my neck, but it's moving down my arm now, and
Okay. And radiating.
yeah.
Okay. Great.
Thank you.
Yeah. Any others? Right. Well, we'll leave it at that then. So, just to remind most of you, since most people tonight seem to be new to Open Forum, this is very much a discussion. So raise your hand, interrupt me. I'd like it to be more conversational versus a strict lecture. I don't have a PowerPoint presentation. I have a couple little chicken scribbles on my pad of paper, but I really want to make sure you guys learn all that you can and have all of your thoughts follow through to completion. So with that, I will kind of get going on our topic of autoimmune disease. So when I use the term autoimmune disease, probably the first thing that comes to mind to people are actual conditions that are called autoimmune diseases. Someone already mentioned lupus. Probably many of you have heard of rheumatoid arthritis, psoriasis, Hashimoto's thyroid disease, Graves' disease, MS is a big one, diabetes type 1. These all ring a bell probably to everyone, or at least some of them. Mixed connective tissue disease, polymyalgia rheumatica. The list goes on, and there are actually hundreds and subtypes of them, and so a lot of these very serious conditions are autoimmune diseases, and they're chronic. So let's get down to what is an autoimmune disease. I think someone was starting to ask that question. And so to start, let's break down that word into its roots, auto and immune. So we're talking about the immune system, and an autoimmune disease means a self-inflicted immune disease. And what that really means in common terms is that somehow the immune system has lost its ability to discriminate between self and non-self. And so on a cellular level, what that kind of translates to is our immune system is composed of all sorts of different immunological cell types. But the principal cell types are T cells and B cells. That's what they're called. And B cells, one of the subtypes, are known as antibodies. Many of us are familiar with antibodies because, especially in the realm of immunization, we talk about creating antibodies to something. And essentially what that is what's called adaptive immune response. Hi, welcome. Sorry, I think we're a little short on chairs. I'm not sure if we have a couple in the back. There's a couple more up here. There's 1, 2, 3, maybe 4. So we might have it. Yeah. Sorry to make you guys split up. So in the context of how this antibody response happens, is that the immune system gets exposed to, say, a virus. And it's a very specific virus. Say it's a strep virus. Well, that virus encodes an immune response adaptively where those antigen-preventing cells go back to the lymph nodes, go back to the immune organs, and they start reproducing antibodies specific to that virus. And so you end up adapting into making millions and millions of antibodies specific to that virus to take care of them, clean them up, and get them out of the body. Now you notice that those antibodies are being formed in relation to a foreign substance, right? A virus. It's not part of us. That could also be a bacteria. That could also be a food particle. But the point is that we typically make antibodies to foreign substances with the hopes of when the immune system flags that substance, that it's like a signal that we need to get rid of that and remove that and destroy it. And your killer T cells come in when it's flagged, and your antibodies come in, and they kill the virus. And that's how we don't succumb to things like viral infections or bacterial infections. Now, there is such a thing also as the creation of antibodies to self. But the immune system has a pretty elegant way of dealing with that and essentially inactivating those self-antibodies, or those T cells that are specific to our own cells. So that process can go wrong sometimes. And when the immune system loses that discriminating capability, that what's called tolerance, then you end up with the potential to develop an autoimmune disease. And that's really how autoimmune disease gets started at its molecular level, is some force causes the immune system to lose its discriminatory capacity, and it starts building antibodies in immune cells towards its own tissue. And that response amplifies and begins to eventually destroy our own tissue. And so oftentimes what we'll see is it will be very tissue specific. In other words, the loss of tolerance or the loss of discrimination happens in a particular cell line. Again, I'll use a couple of examples. Hashimoto's hypothyroid is an autoimmune response to thyroid tissue. Rheumatoid arthritis is an autoimmune response in the joint capsule. MS is an autoimmune response in the myelin sheaths lining all of our neurological tissue in the central nervous system. Psoriasis is an autoimmune response in the skin. So we can see this occurring in different specific tissues, or we can have autoimmune processes that are more global. Lupus is an example of that, where the kidneys and the lungs and the cardiovascular system and the skin and the joints can all be affected. So there's obviously different types. But when it boils down to it, the actual mechanism of what an autoimmune disease is, that's pretty much it. And the challenge to it is, according to conventional medicine, there's no way to reverse that self-inflicting damage process, that misidentification of self with non-self. And so if you actually look at the numbers, it's kind of an interesting thing, because today, rough estimates are around 25 to 30 million Americans have autoimmune diseases, which, if there's about 300 million of us, that's about 10% of our population. It's pretty profound. And that's what's diagnosed. We don't know how many actually have them. Yes?
How does that compare worldwide?
You know, I don't know about worldwide numbers. That's a great question. My research, it was a more precursory research to really see. It is certainly more prominent in developed countries, and certainly more prominent in the US or northern latitude countries for specific diseases, but for example, MS is a good example of that one, where northern latitudes seem to be much more highly effective. And interestingly, women, in large part, are affected more than men, probably in about a 2-to-1 to 3-to-1 ratio. Some diseases are higher, some diseases are lower. The kind of interesting part of that story is that about 100 years ago, it was exceedingly rare to have the onset of autoimmune disease. In fact, it was only really converted into a medical term in the early 1900s because it was so exceptionally rare. Of course, chronic disease in general wasn't that common back 100 years ago. And now the American society, our whole populace, is afflicted primarily by chronic disease. And so this is obviously a big deal. I mean, 30 million Americans, 1 in 10 people having autoimmune disease, right? There's a lot of people suffering out there in need of treatment. And there's, unfortunately, in the conventional medical realm, I feel a very poor model for the treatment of autoimmune disease. I would really call it disease management and symptom suppression versus actually bringing the disease process into permanent remission and addressing the root causes, which there's kind of 2 pieces that I feel are, there are commonly held beliefs in the conventional medical system. One is that the cause of autoimmune disease is really unknown. There's a couple of small hypotheses, but largely if you approach a conventional physician, the response will be, we don't know what causes it, and we're not that interested in that. We're interested in controlling the symptoms. And the second, I think, somewhat fallacy is it is progressive and it is incurable. I mean, that's a point that I'll clarify my nuanced understanding of that. I would agree that it is unlikely that you can completely unwind 100% the potential of an autoimmune process once it's been activated in place, because you've already made those self-antibodies. Your body already has that physiological memory and adaptation. There's always going to be the potential for you to activate that autoimmune response. But I also believe that that autoimmune response can be held permanently in remission, as in to never reappear for the remainder of your lifetime, which to me is basically like cure, if the symptoms are completely resolved and there's no sign of impacted health. So I want to pause for a second and see if there are any questions. Anything I shared? Yeah, please.
Why does it seem that if you have one autoimmune problem, it snowballs into, say, a handful of them? You can't just seem to have one.
Yeah, so that's a very common thing that it's very typical that individuals will acquire more than one autoimmune process. And I think the answer to that lies nicely in addressing that question that I began to start to answer as to what is the cause of autoimmune disease. And as a naturopathic physician, one of my greatest charges, and the reason I ended up choosing this field of care, is that with every single patient I see, one of the leading questions and concerns and inquiry I have is, what is the root cause? How did this person get here to expressing these symptoms? These symptoms are simply the body's way of letting us know we're out of balance, something is not correct, something is impairing the body's intrinsic ability to maintain itself in a state of health and balance. And so the symptoms are a clue to discovering the root causes of the illness. And for that very reason, in the autoimmune process, I think we need to engage with the underlying forces that create the autoimmune process to understand why someone would have 1 or 2 or 3 or multiple autoimmune disease processes going on. Does that kind of help? And I'll get to the causes. We're getting there. So some people, when we haven't addressed the root cause, and we're simply suppressing symptoms, then for sure, if that underlying trigger for the autoimmune process has not been addressed, then there's a potential that more autoimmune processes will be triggered. Yes?
So then, if you know that you have one issue, if you can fix that, then you're more likely to not have another pop up?
Well, my argument is that if you address the root causes of the autoimmune process and resolve those and remove the kind of interfering forces on the body's health process, then you're less likely to develop another autoimmune process because the trigger is no longer there. Yeah. Charles?
Can you explain for a second how you said you can get it and you can't get rid of it? I mean, you can get it from nothing to something. Why can't you go from something to nothing?
And I was just, you essentially can. I was making a little nuance in saying that technically I won't use the term cure with autoimmune because once you have actually established the autoimmune process in the immune system and you have made that adaptive identification of the immune system towards its own cells, you can never make that memory go away in the body. So you will always have the potential to re-trigger that process when the underlying conditions of what create the process are brought back into play.
And what would be an example of like underlying condemning a cause and effect? What would be an example?
Yeah, we're getting there.
Okay.
That's going to be a big next part of the conversation. Yeah. Okay. Yes?
Good question. I always thought I inherited thyroid
Well,
issues, but
That's a good question. So, yeah, I'm glad you brought that up. And it's a causative question, right? What causes autoimmune disease? One of the things we can observe is that it runs through families, right? Hashimoto's hypothyroid, mom had it, grandma had it. Lupus, several family members. It actually is something that has been shown familially to be drawn through lineages as perhaps providing a higher risk potential. But again, if it's genetic, then why doesn't everybody in the family get it? Or if you've never had an ancestor who's had rheumatoid arthritis, why do you get it if no one's had it? So clearly there's other forces in play. But I would say that in terms of vulnerabilities, and I talk a lot about with my patients transgenerational vulnerabilities, just because the genetics are there, it doesn't mean you're destined for that. It means if you pull the right triggers, then it's more likely as that to manifest as one of your vulnerabilities in your health. So, but yes, familial kind of family history is definitely a risk factor and perhaps part of causation. Yeah.
I have another question.
Sure, please.
My theory of the root cause is stress.
Oh, we're going to come to that soon.
Yeah.
Yeah.
Family history or whatever, but if you
Yeah,
have that
yeah.
on top of it all,
Yeah, we'll get to that for sure.
it will cascade down.
Of course. Yes, in the back.
Is collagenous colitis considered an autoimmune?
That's kind of debatable, but it's definitely considered at the very least a precursor to defined autoimmune diseases, which are Crohn's and ulcerative colitis, or inflammatory bowel disease. I forgot to mention that. Those are some big ones, Crohn's and ulcerative colitis. Yeah, so it's kind of one of those that the histology part where you go and look at the cell lines and see what's going on, it's something in medicine that's kind of in the works of defining more clearly. But I think there's a great potential it could be an autoimmune type process.
Well, I just wondered because my sis has the Hashimoto's thyroiditis, she's got that, she's got rheumatoid arthritis, so when you talk about having one, potentially 3 to 5 or whatever,
Yep.
I just wondered if that was maybe linked in there with
Yeah.
the others.
Yeah, and it'll drive back to actually one of the big parts of conversation around intestinal health and its relationship to autoimmune disease, which is a big part of our conversation. So, yeah, any other questions before I move on? Okay. Well, let's kind of, well, I just want to mention real quick, again, kind of in the conventional mindset, at least my experience working kind of with my colleagues in the area, is that mostly the goal is to manage symptoms with autoimmune. And so typically what symptom management ends up translating to in my terms is suppression, suppression of symptoms. And so the toolbox that is generally employed, it's obviously condition specific, but one set of tools that kind of resounds across the whole line of autoimmune processes is when we talk about the process itself, right, it's the immune system attacking itself, causes inflammation. The inflammatory process over time destroys tissue. And this is the your own immune system doing this. So all conventional treatments are generally geared towards either mitigating inflammation through cutting down the inflammatory cascade in the immune system, or outright suppressing the immune system. And so there's kind of layers of severity that are usually stepped through. So the most basic layer oftentimes are things like anti-inflammatories like Tylenol and Advil. You'll see with rheumatoid arthritis, you know, Advil, ibuprofen being a real main starting point. When lupus affects the joints, you know, ibuprofen. One that's more common and universal across all autoimmune diseases is steroids. Steroids, you've probably heard of prednisone, cortisone. They can be used topically, they can be injected, they can be taken orally. And steroids essentially are substances, corticosteroids, that suppress the immune cascades. They suppress the immune system, and therefore are going to suppress the symptoms. So, and then beyond that, we get to actual immunosuppressants. These are drugs that are usually very expensive and very, very powerful and very serious. They have to have really regular blood monitoring. There's major susceptibilities to infection with both steroids and immunosuppressants, because for suppressing the immune system has a lot of roles to do, right? We need it there. We need it to fight infection. We need it to remove viruses and bacteria. We need it in our gut and to process and associate whether something's friendly or not. So, you know, we're really also in palliating symptoms, potentially causing a lot of harm. The side effect lists for things like methotrexate or Humira are pages and pages long. If you ever have a care to read the kind of drug insert. And that's because of how powerfully these drugs exert forces on the body. And so we're talking about anemia, we're talking about impaired growth and development, we're talking about cognition issues, we're talking about all sorts of issues around hormones, pretty severe stuff, tissue degradation. So this is the pitfall and the frustration with conventional therapy is, while it can be life-saving in terms of the amplification of the autoimmune process, it can be life-destroying over the long term in terms of what those drugs create in other realms of one's health by means of the suppression. And so when many of my patients come into me, they tell me, well, I've been told that I'm going to be taking the drug for the rest of my life, this drug for the rest of my life, and I read the side effects and that scares the crap out of me. And I say, I don't blame you. It would me too. And usually the next question is, well, I really want to figure out what I can do and how we can get to the root cause of it and not need to take these drugs. Sometimes I diagnose autoimmune disease too, but most of the time I'm more being turned to after that part of the conversation and the fear that comes with that. And so in that context, I think it's really appropriate to begin down the line of, well, okay, symptom management, we can do that in naturopathic medicine too, and we can use different tools, and we got some great tools. But I'm really interested in getting to that root cause question and being able to put this thing in permanent remission by identifying the causes of the disease process. So before I launch into those, is there any questions about my conversation with conventional treatment, kind of the types of therapeutics and the focus of that type of intervention, and how kind of we go about it? Yeah.
Does insurance cover any of this type of treatment?
Of natural medicine? It depends on your insurance company, but in terms of my clinic, the structure of it is not based on contracting with insurance companies. Yeah. And we can talk more about that after too. I always stay for questions and stuff. Let's go into that deep question of cause. And really, to start with, whenever someone comes in with an autoimmune process, I ask about the symptoms. Certainly, I want to really individualize their unique presentation of the symptoms, because that's going to discriminate on a personal level about how I treat that person versus the next person who also has rheumatoid arthritis, right? No one gets the same treatment. So I really want to know how they experience it to know how to help them. But equally important, I want to know, when did this begin? Tell me about when something first was amiss. When did this process amplify? And the stories are pretty amazing that I get to hear. And that is so enlightening to me about understanding the root cause and how to go about cure. Because inevitably, I always will hear about a very specific time in someone's life where maybe one thing, maybe multiple things were occurring simultaneously to essentially cause that loss of discrimination in the immune system, to make the immune system lose its intelligence or its ability to sort self from non-self. One of the known scientific models that's somewhat well known in the conventional medical field is an exposure to a really severe virus or bacteria. Specifically with type 1 diabetes, you'll see this a lot. Kids who had really, really bad cold and really bad fever, cold, lasted for a long time, develop type 1 diabetes very shortly thereafter. The mechanism there is called what's called molecular mimicry. That microbe looks a lot like our own tissue, and in the immune system amplifying a response to that microbe, it makes a mistake and actually creates a responsiveness to its own tissue. And in a very small subset of cases, I've seen that be the principal cause. It's usually in children when I see that versus adults, which another change that we've seen is this autoimmune disease has mushroomed and ballooned. It's much more a disease onset in adulthood versus childhood proportionally.
For clarification, what you're saying is they have the cold and then they get type 1 right away, or it expresses later on?
It's somewhat delayed, but it's relatively soon thereafter, within a matter of weeks to months.
Okay.
Yep, and that's actually decently well known in the conventional community. But that's a viable path. And one thing that I'll bring up that's fairly controversial is vaccination, which of course is injecting not only a microbe, but some very powerful substances like aluminum and mercury into our tissue, which is highly antigenic. It's designed to elicit a really strong immune response. And so in that sense, I can speak personally to my clinical experience, seen numerous patients who we believe acquired autoimmune diseases as a result of an immunization. And so that's another process, especially in childhood, that can, I believe, trigger that loss of self, non-self. So that's one thing to mention, and certainly that's a very important part of the story. When we find that out, there's not a lot we can do about that, right? I mean, that happened when you were a kid or what have you. The autoimmune process started, and now we have to deal with how to treat it. Much more frequently, what I find is, wow, when that MS started, there was a lot of stress in my life. I was going through a lot. I was moving. I had a job that I hated. I was in a toxic relationship. My mother died. There was a grief that was very profound in my life. And it really kind of ends up being, in my mind, probably the most profound trigger for people is the individual's method of coping with stress. I want to be very clear, we all have stress in our lives. And yet, it's how we respond to stress that really has the biggest impact on our health. And so generally, again, as a generalization, I find that in individuals particularly that have a challenge in being really well emotionally self-expressed, that this can be a major causative force in bringing on an autoimmune process. And you know, the term I use to describe that is when there's a lot of psychological, psycho-emotional stress, it impacts the immune system. And I can't point to studies about that. I can't cite 100 articles, but I can point to clinical experience about it and state that it absolutely impacts the immune system's intelligence and discriminatory ability, so that these mistakes we talked about molecularly can start being made. And so oftentimes I feel that that can be the trigger to someone's autoimmune process when there's a particularly intensely stressful period in someone's life, or a chronic responsiveness to stress that is not healthy. In other words, someone's ability to acknowledge, express, let go of something that impacts them on a stressful level is poor. They haven't developed those skills. Most of the time to no fault of their own, but they were taught growing up in their families and how communication happened and kind of emotional vulnerability came about. It's not really something that was ever learned or known. And so in learning that cause there of the stress element or the response to stress, it gives me a big clue on where the work is that we need to do. Because if we know about how that trigger came about, we can sure bet that that process, especially if they're symptomatic with their autoimmune disease, is still going on. That response to stress and psycho-emotional suffering that is being experienced is still ongoing. And that ends up becoming a very big part of our intake and dialogue is how do you experience stress and you know, what do you do with it? And what are your sources of stress? And teach me about relationships and work and childhood and past traumas that you still carry. And let's talk about how to develop tools to be self-expressed and to react to and have your body respond to stress in a very different way and in a healthier way that's more in alignment with who you are. And those tools are many, and I can talk about some of them, but again, with naturopathic medicine, it's such an individual practice that it's really learning that person's unique story and the forces that have brought them to where they are today. So being able to navigate that conversation, I think, is a lot about being a good listener and in helping people create insights into the places that they are stuck or that they are reactive in a way that is not healthy to them. Okay? So big concept, and I know I'm being somewhat vague about it, but it's because by necessity, because no two people are alike in exactly how that manifests for them. Any questions about that concept?
I have a question about the immunizations.
Sure. Yeah.
So how do you feel about the flu vaccine?
Yeah. I guess what my thing about immunization, without totally diving into immunization, is that I'm a really big proponent of my patients being self-educated about immunization, and I like to provide a lot of resources so that they can become educated. And that's really kind of my stance on immunization. If you were to ask me, is it possible that a flu vaccine could cause an autoimmune process? Yeah, I think so. It has adjuvants in it and attenuated viruses that I believe can manifest that immune response that we were just talking about.
I have a question about that. What if you work in a place that requires you to have it or you will be fired and you
Yeah.
already have an autoimmune problem? How
Yeah.
would you, so you
Yeah,
have a
yeah,
choice.
and unfortunately, a few of my patients have literally had to seek other career choices because of that problem for their
And
belief
the
systems.
unfortunate thing is that this is a healthcare
Yeah,
facility that does.
for sure. Yeah, and it's the healthcare facilities that require it. So, yeah, and again,
Which is ironic.
I've dabbled in the consideration of doing a immunization lecture, but it's so controversial.
Oh, it is.
I
Whole other night.
yeah, it is. It totally is. So, yeah. Yes. I've
So
never-
technically, as a physician, you could write an order saying that this person can't get a shot.
Potentially, there has to be. Often there's pretty stringent requirements for the hospitals to actually accede to that request. It's not just as simple as I don't believe this person should have immunizations. Yeah, but I mean I've tried and sometimes we're successful, and there's homeopathic immunizations, and that's something our clinic offers that is a safe alternative, but again, on a hospital level, it's not acknowledged as viable. So, yeah.
Immunizations, you're right, very controversial. When my granddaughter was born prematurely,
Yeah.
the pediatrician told my daughter that she should not have her child around anyone who had not had a recent pertussis vaccine. So of course, the whole family, we all went and got
Yeah.
it. I mean, clearly, immunizations have resolved over the years, eliminated disease.
No. Yeah.
So there's something good about them.
Sure.
But are you saying that you actually have an immunization that would take the place of the pertussis? It's so terrible up in Bonners.
Yeah.
The amount of pertussis, and
Yeah.
it's rampant in the schools.
For sure. Yeah, and I treat a lot of pertussis too.
So, but you can do that without the vaccine then?
Yeah, I mean, again, it's.
I mean,
it's
I don't
this-
mean treat it when you've got it. I
Yeah,
mean, not
yeah.
getting it.
Yeah, I mean, there's ways to protect the immune system, and so many ways to make the immune system less vulnerable to pertussis, including homeopathics and many other methods. Yeah. Yeah. And I'll mention something else in autoimmune processes that I think is kind of interesting. One of the theories advanced too as to why our modern society is just in epidemic proportions of autoimmune disease is the ability of this body to discriminate self from non-self has to do a lot with getting a lot of practice. And so when our kids are playing in the dirt and picking up and sticking things in their mouths, we're getting exposure to plenty of bugs. We're getting the immune system very used to identifying what is me and what is not. And so one of the arguments of why there's an epidemic of autoimmune disease and allergies and things like asthma in modern society is called the Hygiene Hypothesis. It's because we, as human beings, are 90% bacteria and 10% ourselves. And this gets into the next big focus of what causes autoimmune disease, which is understanding the role of our own intrinsic microbes in the health of our immune system. So the concept of the Hygiene Hypothesis is that the reason we have so much allergy and autoimmune going on in part is that we have deprived our immune systems of the ability to be exposed to all these bugs in our environment, and as a result have caused hyperreactivity responses either to ourselves or to other processes like allergens of things that are not intrinsically harmful to us. And the Hygiene Hypothesis is something in clinical practice that I see played out on a very frequent basis, especially more and more modern as we get more and more into hygienic methods. Yeah.
But most of us here, a lot of gray hair in this room.
Sure.
We did plenty of dirt playing. We
Sure.
did plenty of all that. Way before
Yeah.
all this antibacterial junk.
Yeah, sure.
And yet here we are.
With autoimmune disease?
Yeah.
Well, that's why it's a small, to me, a very small player. What I want to get more into is when I'm talking about the 90% of us that are bugs, is I want to talk about intestinal health. I want to talk about inflammation. Because the major force, the other major force that I believe initiates an autoimmune process is a highly amplified inflammation process in the body. In other words, if the immune system's nice and happy and tolerant and there's very little inflammation, it's way less likely to make mistakes. But if there is high levels of inflammation throughout the body and there's a constant immune response going on that's very extreme, very amplified, the immune system's going to make some mistakes eventually. And there's going to be an environment in that cellular, that tissue environment that, well, there was a mistake made and we've made antibodies to our own cells and here's the unraveling process of an autoimmune disease. And so understanding that our modern society, what I feel is in epidemic proportion also is inflammation. Our bodies are inflamed. Our bodies are reacting to the circumstances we are putting them in. Right? Again, the inflammation is not like, well, people in 2017, their bodies do the inflammatory response more than they did 100 years ago. The conditions are different, right? Our environment is different. Our habits are different. Our gut dynamics are different. And so when we talk about the concept of inflammation, inflammation can come from a lot of things. It can come from external triggers. We can be breathing in toxic air, or we can be exposed to something that we touch that causes an inflammatory response. But the main place inflammation happens is through what goes through our mouth. And that process is, of course, mediated in the intestinal lining. And again, when I say inflammation, what I'm really saying is immune system, right? The immune system is active, right? That is what causes inflammation, is our immune system. And so this hyperactivity of the immune system, if we're to really understand where does that come from, then I think about 80% of the answer to that or more gets traced to the gut and what goes into our mouth. And most specifically, what goes into our mouth, other than air that we breathe and water that we drink, is food and other beverages. So what's really changed in the last 115 years, probably more than anything, well, there's two things: our stress levels and what we eat. And so if you look at what the vast majority of Americans eat today, the majority of what's being consumed, I wouldn't really call food. I would call it substances that are produced in a factory. They're food-like substances. And this is a big challenge to this gut that has evolved over centuries and millennia to be geared towards eating exclusively whole foods that we went and dug out of the ground, that were covered with bacteria, by the way, that are metabolized in a very specific process that our immune system is highly involved in. And a big part of that process of breaking down and assimilating our food is that 90% of us that are the bugs in our gut. The trillions and trillions and trillions of organisms that can either be very friendly to that process and therefore friendly and creating a tolerance response in the immune system, or they can be unfriendly and out of balance and causing an inflammatory response to the immune system. And so this, to me, is a colossal part of the treatment of autoimmune disease, is becoming very specific about where inflammation comes from, identifying and understanding how to work with intestinal health, and modulating the immune system through working with intestinal health. And so oftentimes, again, when I go back to the story of tell me about your life when you developed this autoimmune process, probably there was a stress, but then oftentimes, usually I'll hear, yeah, and I've always, you know, had a really bad problem with constipation, or when I'm stressed, I always feel it in my gut, or I'm very prone to bloating, or heartburn, or gassy, or abdominal discomfort. Exceedingly common that I discover some actual obvious gut-related symptoms that may be very likely chronic. Or someone will tell me, yeah, when that started, I remember I was, you know, eating way different and, you know, not my normal, typical healthy diet, and that was part of the onset, perhaps. And so, again, we really have to look at that in terms of causation, and in knowing that as part of the causation, helping that be part of the cure, right? So if you don't address that process of gut-mediated inflammation, then yeah, the autoimmune disease process is going to progress. Because in an environment of hyperactivity of the immune system, the autoimmune process is also going to be hyperactive. And so, again, that 90% of us that are microbes in our gut, one of their main roles is to facilitate a tolerance response in the immune system. They're called Tregs, or Th17 cells, the immune cells that interface with our gut flora. And so when we eat cookies and crackers and chips and soft drinks and all that stuff, we're taking our gut flora and totally twisting them up into a new orientation and a new balance that modulates that Th17 and Treg response, and furthermore starts to create holes in our intestinal lining, right? The inflammation starts in the gut. So those bacteria get out of balance, they start the kind of what are called opportunistic or bad bugs, start taking over control. They start eroding the lining of the intestines, and an inflammatory response starts developing in the intestines. And then that response transmits into the bloodstream as now this leaky gut lining is basically passing through cells and inflammatory substrates and microbes. Now that you have a leaky gut, big breach in the wall in terms of the immune system's defense, things are just riding right on through to the immune system, and in the bloodstream, and the immune system's getting real active, starting to get really inflamed, and that might transmit to migraines, that might transmit to joint aches, that might transmit to painful menstrual cycles, it might transmit to fatigue, or in certain cases, it could transmit all the way into an autoimmune process. So by no means is this gut-mediated inflammation going to end up in autoimmune at all. In fact, most of the time it doesn't. It's very uncommon or rare for that to occur. But it does. And I think, again, that primary source of inflammation and the mechanism of how that begins in the gut is an incredibly central premise of my belief system in understanding health and how to help people in achieving greater health, is to work on that gut level. So I want to pause for a second and see what kind of questions have come up from that piece of talking about the cause process. Anything?
Mine's more a comment than a question.
Okay.
But I eat a relatively healthy diet.
Sure.
And just got back from vacation and totally indulged. And it was just like fabulous food and drink and dessert, and came back to the hotel room and my stomach was just like, oh, I mean, it was just noisy, I was miserable, I couldn't sleep. I'm sharing a room with my sister and she's just like, oh my gosh, you know, I need earplugs. And it was just like, it's so, you know, it has an immediate effect on your body.
Yeah, and the interesting thing about that that's a little mystifying to a lot of people not really engaged with food as medicine per se is that, you know, you tell them, well, so we got to, you know, go into obviously when we're talking about treatment, well, what foods should you eat? And then we're going to talk about that. But when you get to talking about people's intolerances, foods that their immune system reacts to, it's like, well, yeah, but when I eat that food, I don't feel bad. And part of that has to do, but you said I eat really healthy, and then when I ate those foods, oh my God, I felt terrible.
Yeah, and they weren't bad foods, but it was
Yeah.
like, you know, a
Foods
steak, you know, it was
yeah.
meat, it was something.
Foods that you're a little reactive to.
Mhm.
And so the analogy I use is, you know, say you're driving on the freeway at 80 miles an hour and you speed up to 81, you're probably not going to notice that. But if you're going from 0 to 81, you're going to feel that and notice that you're accelerating. And I liken that to a food intolerance in that if you're eating, say you're intolerant to wheat, and you're eating wheat every day, each time you eat it, it's like going from 80 to 81 because your immune system's already so revved up about it, you're not going to be able to distinguish the difference. But if you eliminate that food for a month, it's just called a strict elimination challenge. You don't eat it for a month, and then you challenge it, you're going to be getting the 0 to 80 response, and you'll definitely be able to identify that food as an intolerance, which is a gold standard and requires no testing. It's a way to identify what foods you're reactive to. So that's, again, as we get into the next piece of engaging with, well, what do we do about this and how do we go about improving, healing the gut lining, rebalancing the flora in our gut and creating that tolerance response in the immune system, shutting down the inflammatory cascade. Food is the #1 force to talk about because that is ultimately what shapes who we are, and certainly on a gut level. So, you know, that ends up becoming a big part of every conversation I have with any patient, but certainly in an autoimmune process, is I want to get really clear about attenuating inflammation in the body, and getting to the root causes of where that inflammation comes from. And so identification of food reactivity is a big deal. There's a lot of ways to go about that. You can do it with antibody testing to foods. I do that exceedingly rarely because I don't find that I need to. You can ascribe to various diets. There's something called the anti-autoimmune diet. It basically takes off the most typical allergens or intolerant foods and says don't eat these foods. And it works great for a lot of people. There's anti-candida diets, there's Mediterranean diet. I mean, there's hundreds and hundreds of different diets. And so you could go to a lot of different doctors and get a lot of advice. The sad thing to me is that, again, in the conventional model, the nutrition and gut dynamic and inflammation aspect of what creates that is like, well, just eat whatever you want. It doesn't matter what you eat. Especially, it's a real head scratcher to me when they have IBD, like Crohn's and ulcerative colitis. And there's like 0 time spent talking about nutrition and gut health and food. But nevertheless, that's typically your response unless you're in a pretty unique circumstance. You might come to a doctor with an idea and they'll say, that sounds good, go for it. But it's usually, you know, discounted. And so to me, it's a huge potential area of seeking towards a cure. And it's hard, and I think I'm very blessed as a naturopathic physician to see the subset of patients that are coming to me seeking and willing to engage in profound lifestyle change, because it's a big process to transform away from things you have become accustomed to in a habitual pattern sense around food. But you know, that's the work that needs to be done if we want to come about a cure. And that's what I can say about 90% of my job, or the work that I do with people, is identifying and removing obstacles to the body maintaining a state of health. And it's understanding and discovering what those things are, what those actions we are taking in our life that impair our body's self-regulatory abilities. And that includes, you know, on the mental emotional level, right? We talked about stress. So we have to have that conversation and discover where the places of blockage are and where tension is held in the body and how to transform that. So getting back to the inflammation model, I mentioned a couple of things. We can look at all the different diets. We can do antibody testing. I think looking at someone's genetics is an incredibly valuable method. I like the blood type as a good starting point. And those of you who are patients in here are very familiar because we talk about that a lot as a starting point. It's just a starting point. It's not, everything, but understanding how our immune system reacts to foods based on our blood group is actually a pretty good science, and clinically has been very effective in my work with people. So that knowledge is very useful, and like probably half of my new patients don't know their blood type, so we usually type them when they come in. But that's something for me that's worked very well. Of course, there's the elimination challenge. If you have an autoimmune disease, or one of the audience members, you could start with the biggies: cow dairy, wheat, potatoes, tomato, and start doing an elimination challenge with each of those foods. Do your symptoms improve? Very likely some of them will when you remove a major inflammatory food from your system. Yeah.
When you talk about gut health, do you also include intestinal and colon?
Yep.
And some people use colonics.
Sure. Yeah, we have a colon hydrotherapist that practices in our clinic. Yeah.
So that would be part of a healing process?
Potentially. Not commonly, but potentially. Yeah, and of course it's the whole intestinal tube. It's from the mouth to the anus. That's what we're focused on in terms of our exposure to the outside world. That's the biggest one. If you spread out our small intestines, the surface area of it, it's the size of a football field. Yeah, but not many people knew that. And as I said, probably not many people knew that 90% of what we are the bugs in our gut. 90% of the cells in our bodies are bugs in our gut. So, another example of a cause of autoimmune process, I see this one relatively frequently. I got an infection, and then I took a big whopping course of antibiotics. So not only was the microbe or the virus or bacteria there, but I took an antibiotic and pummeled my gut flora, and an autoimmune process arises, which happens frequently too. Certainly antibiotics are a mode to getting to a place of leaky gut, dysbiosis, intestinal inflammation, which is why I can count on one hand the number I've prescribed in my career, because I think I'd like to avoid it at all costs, although sometimes it's necessary and can save someone's life. So, in engaging with inflammation as it relates to the gut, first is to work with food. And I use the term food. I'll go back to that statement about food-like substances that most of us consume. Let's go beyond just, intolerant foods to what we're eating. I mean, it's this essentially insanely high processed food-driven societal diet that's culturally infused in everything we do, from when we socialize and drink alcohol, which is sugar, to what's given in our schools, to how we show gratitude to each other by bringing each other sweets and cookies. I mean, these things were not in existence in our ancestral diet, right? It didn't exist. And we're hardwired to crave sugar and salt and fat because they were so rare to find that we had no access. And we were mostly eating, fibrous roots and plants out of the ground. That was about 80% of our ancestral diet. So when you look at the typical American diet, that's about 60–70% processed food. We're eating 300 pounds of added sugar a year. We're eating, 10 grams of fiber on average, versus 50 grams of fiber that the ancestral human diet was accustomed to. Fiber is what keeps our flora and our gut nice and healthy. They eat that fiber and stay really kind of in alignment because of it. Yeah, we have a big problem. And so, we could dive into a big lecture on what is good nutrition and generalizations, but I want to make sure that I leave time for questions and stuff. And really, it's an individual question there too. I mean, I never give any patient the same diet. It's, like I said, blood type often is a starting point, but we're going to be much more specific based on someone unique needs in that case. So any kind of questions or thoughts? Are we kind of getting the concept of how this relates potentially to autoimmune? Okay. Yeah, back there.
Do you recommend a probiotic for most everybody that comes into your office and has some
Yeah, good
issue?
question. Yeah, so probiotics we can transition into some of the therapeutic tools beyond the importance of nutrition. Probiotic can be a very useful tool, and I'll say very commonly with someone with an autoimmune process, I will be recommending a supplemental probiotic or really counseling and educating on probiotic foods or how to create your own probiotic foods. So yes, it's a very common tool I use, and the concept there is that the probiotic is going to interface with the flora that's already in existence and help kind of set a little toehold for the friendly bacteria to thrive and grow and establish themselves and crowd out the bad bacteria. But I would hate to call it a cure or a treatment that is going to work standalone. And if someone judged natural medicine on, I took a probiotic for my autoimmune disease and it didn't help, not surprised. But in conjunction with lifestyle modification, for sure it can be very useful. There's a lot of other intestinal healing agents. Again, a lot of it has to do with the unique situation. Does someone have low stomach acid? Does someone eat really quickly and not chew their food? Do we just need to talk about food hygiene? Can that be a huge player in improving the integrity of their digestive system? Do we need to assist the pancreas with digestive enzyme output? Do we need to help the gallbladder emulsifying fats? Do we need to enlist healing agents to seal up the lining of the gut? Do we need to actually go in and wipe out some of those unfriendly microbes and use herbal antimicrobials to kind of kill the weeds so the good grass can grow? Do we need to address someone's issue with reflux and soothe and heal the stomach lining, or engage with getting the bowel to empty and move itself regularly? So there's so many ways you can approach that to get at the underlying health of the intestinal lining and the immune system. But that's kind of, again, really individual as to what I would prescribe, and so I couldn't universally say for autoimmune, this is what you should do. So, then you can transition to some broad spectrum agents that I would consider very helpful in the autoimmune process. I think that vitamin D is something I ask everyone to take. If you look at autoimmune diseases and you do studies on them, you can find that vitamin D levels are dramatically lower in people with the autoimmune diseases than the people without. The catch-20, or the conundrum there is their vitamin D levels too low because there's inflammation and that's affecting vitamin D, or is the low vitamin D a potential trigger for the autoimmune process? I don't think there's any way to really answer that question, but what we do, and what I think is a very wise idea, is to bring vitamin D levels up to therapeutic values, which is very different than what conventional medicine considers sufficient. So I like to see a vitamin D anywhere between 50 and 80 nanograms per deciliter. And I don't think you can do it from getting sun, especially if you live here. So I think that almost all of my patients supplement D. And particularly in certain autoimmune processes, it's like an incredible risk factor, like MS is one where there's just this huge establishment of low vitamin D. Psoriasis is another big one. Hypothyroid if it's autoimmune. So that's definitely one I'm always using in the autoimmune process. Yeah. Okay.
So with these certain blood tests that you do, can you identify, I lost my
The
thought.
vitamin D or
What you,
inflammation?
yes, target where the inflammation is?
Not very well. You can do things like C-reactive protein or sed rate, but that's not really going to tell you where the inflammation is coming from. You can do imaging and go look at the intestines, but that's invasive and expensive. So I let the body guide me. You know, the symptoms are really, that's where the detective work happens as a clinician, is understanding what the symptoms point to in terms of where the dysfunction is. Of course, I use laboratory tests all the time, and really advanced ones. I do stool tests, I do salivary testing, I do urine testing for heavy metals, I mean, hormone testing. There's a lot of testing, don't get me wrong, but to understand where the inflammatory process is going on, most of it is history and physical exam to understand that.
What are we looking at financially? It sounds like a big cost to me.
Well, again, it's a very individual picture, and you know, in terms of becoming an established patient, I'm happy to chat with people after our fee schedules on our clinic website. So I think considering the type of care you're getting, it's very reasonable compared to the type of care expected in the conventional system. Yeah, and I don't necessarily do a lot of testing on everyone. As I said, it's you know, not the first place we go, but sometimes it can be very helpful. And certainly in diagnosing autoimmune processes, laboratory testing is part of that process for most people. When I do diagnose it versus have someone come in already diagnosed. Yeah.
Could you repeat what you consider a therapeutic value of vitamin D3?
Yeah, 50 to 80 nanograms per deciliter is what I like to see. Unfortunately, I'm so ticked about this. The new protocol now is when unless you specifically request the right test, it'll just say if it's whatever value it is up to 60, and then it just says over 60, which is like, well, first of all, then you don't know if it's toxic, if it's too high, but you don't really know where someone is. And so when our clinic, we specifically test the actual value, because I think a value upwards towards 80 is pretty good. Once you get above that, I'm wanting to cut back dosing.
So in IUs or
IUs.
micrograms,
Yeah.
what dosage would you recommend for a person to be a therapeutic dose?
Per individual, it's person dependent, but generally 4,000 units for an adult is what I consider a D3, is what I consider the kind of baseline. Yeah. So there's vitamin D. Many of you are familiar with fish oil. Concept of fish oil is kind of like, it's a natural anti-inflammatory, but it doesn't carry the side effects with it of something like ibuprofen or a more suppressive conventional drug. It's really addressing the fact that one of the parts of inflammation is an imbalance in type of fatty acids in the body, omega-3 versus omega-6. Modern American diet is about 20 parts omega-6 to 1 part omega-3. Ancestral diet was about 1 to 1. So understandably, you know, giving therapeutic doses omega-3s to try to rebalance that ratio is going to drop the inflammatory process down. I don't prescribe tons of fish oil because I really like to do that through diet if people are willing to do the work. But in autoimmune cases, especially when they're symptomatic and we're trying to provide some more immediate relief, we may use therapeutic doses of really high quality fish oil. And quality is a big issue with that supplement. Same thing with probiotics. You really need to be picky about what you're using, because if you get it at Costco, you might as well, you know, just dump it in the toilet because it's not helping. But that's just a little caveat. And I have other lectures that I think are probably on our website where I talk about supplement quality and what to look for, but we just have to be careful, because the unfortunate thing about my field is that the whole industry is unregulated. And so we have no guarantee of viability and quality. And as the consumer, unless you're essentially not just a physician, because conventional doctors don't know anything about these either, you really need to be kind of in my field to actually put the time in to understand sourcing issues and quality issues and the active form of the medicine and absorption issues. And so those are all really important things to consider when you do supplementation. And there's lovely people who work in places like Pilgrims, but there is zero medical training of those individuals. And so that advice is fine, but it's not necessarily going to provide that depth of knowledge that, someone else might be able to. Is there a question?
There are so many probiotics out there. Would you recommend a
Sure, yeah. I really like soil-based probiotics. There's one company that does a really good job with it called, I think they're called Environmentica, and the name of it's Prescripticist. That's one of my foundational probiotics I use, Prescripticist. I also use one called Ultimate Floramax, and I think they have a kind of consumer line here. It's a refrigerated one. Almost always it needs to be refrigerated to be viable, unless it's soil-based. There's one called Theralac that's really good. Claire Labs makes a really good probiotic. Therabiotic Complete. Yeah.
Soil-based?
Soil-based organisms. Yeah.
How about Garden of Life?
Yeah, I like the Garden of Life one. Yeah, a lot of people have that. They're a pretty good company.
And another question is, are we supposed to switch our probiotics? I was told by somebody that you're supposed to switch them out every month or every...
No, not necessarily. And again, there's so many ways to do it through your food too. So that's another way that we can do good supplementation without needing to take a capsule.
So the gummy bears probably are.
No. No, you're probably not.
I know, it's Kim.
Probably not getting what you need there. Yeah. Yes.
So good.
My question is about the probiotic, and then I heard the word Costco.
Sure.
They just had a big vitamin sale, and I really,
Stocked up,
I stocked up. There were some probiotics. I've heard so many good things about them, but I don't know how to use them.
Well, it's not that the good thing about supplements, they're not going to cause a lot of harm. But, you know, if you're trying to use them as a medicine, and that's where so much skepticism comes in the conventional world, because they're not often being prescribed appropriately, nor are patients utilizing something of therapeutic quality. So understandably, I get why most doctors say, yeah, supplements are junk, don't take them. Because there's such a big issue that I just described. Yeah, Charles?
What's your thoughts on probiotics for children?
Yeah, I do use different strains for children.
But you don't use the gummies, apparently.
I don't. I use powders mostly, and I actually do use some chewables for a certain age group that have a non-caloric sweetener.
So you don't necessarily recommend it on a regular basis? for
No,
children?
usually when they're symptomatic. Usually when there's an issue, we're trying to directly treat. Yeah, in the back.
So how do you know when you're, because I think a fish oil is probiotic,
Yeah.
or fish oil that's pharmaceutical grade,
Yeah.
how do you know when it stops working for you at that level?
Well, you could stop taking it and see how you feel. That's usually what I tell people to do. Yeah. So, and I think with all your supplements, well, some supplements are not very obvious, but there's very good clinically reasons to use them. But when we're dealing with anti-inflammatories, there should be a difference symptomatically if we're talking in that realm. Probiotics, maybe, it may be more subtle and hard to understand how they're interacting. Yeah. Other constitutional things, I mean, again, there's other anti-inflammatories, like I'm a pretty big fan of curcumin, which is a medical extract of turmeric. There are specific preparations that can be very effective. I employ them in autoimmune processes sometimes. You know, that can be a really good thing. But again, the take-home message here is it's really an individualized picture in terms of what to be utilizing. And what I was kind of thinking is that we have about 10 more minutes, and then I'll go through these. But I wanted to maybe, because there's all these different autoimmune processes, I feel like I've really touched really well on the causes and the beginning approaches to treatment and the work to be done there. But in terms of specific autoimmune processes, I'll often have different, more nice go-tos and focuses on how I treat them. And so I thought maybe people who want to remain and talk a little more specifically about that could kind of, you know, mention which autoimmune process they're curious about. And I might say, well, it's the things we talked about, but there might be a couple of other specific medicines. So in a second, I want to open up to asking that question and having people kind of put out which processes they want to hear a little bit about. But did I miss anything about the context of the autoimmune lecture that people were hoping to learn about? I think one of the questions I'll bring up is, can you do this therapy in conjunction with conventional therapy? absolutely. And most of the time people come in on drugs. I mean, they're on immunosuppressants. And so I always say we want to build a foundation around their health, address the underlying obstacles to their health. Then, when your body's ready, you can talk to your conventional physician, or I'll dialogue with them and collaborate with them on how to do a taper off of your med and make sure you don't go back into a flare, which is often very successful. And you know, as a naturopathic physician with the training like a medical doctor, I mean, we speak the same language. We have a different toolbox and a different understanding perhaps of what creates health, but we're collaborating and working together all the time. So that's definitely a part of the journey with everybody, and I'm very much there as part of a team, and I'm not sitting here saying conventional medicine is not useful or a bad thing. It absolutely is, but a good thing. But chronic disease is something that I don't feel like our medical system does a good job of treating, and I don't blame the medical system. I also blame our cultural and educational norms of our society. I mean, we don't think of food as something that we should have to pay attention to, or that we should have to alter our routine around. And generally, my conventional colleagues have people coming in saying, please give me a medicine for this symptom. I don't want to do any work. And that's a tough plight to be in. So again, I really want to emphasize that the core of our work is about empowering people to take control of their own health and become their own doctors. I want to work myself out of a job. It's very satisfying to me to see that happen and to see the transformation that occurs for people. But I don't do that. I might be a mirror for insight for people to somehow have that exchange catapult them into seeing their life in a different way as it relates to stress or psycho-emotional well-being, or how it relates to their choices to engage with habit change of things that have been long entrenched in their life. But I don't do that, they do, and they deserve all the credit. I'm just kind of a coach and a guiding force in the process. So that's a key part of understanding, you know, the healing power of the body is, the biggest part of it is, let's get out of the way of it by addressing the core obstacles to cure. Yeah.
I have been, for the past couple of years, working real hard to get to a good place.
Yeah, great.
Not there, far from it. But I'm also 65 years old, and I've been cooking for 55 years, and I'm sick of it. And so I've been trying to eat real food.
Yeah, good.
But I find that I just can't not grab that bag of organic salad already ready to go at Costco.
Well, that works.
Am I getting...
Sure. That's a real food.
Well,
Yeah. If it's a real food, if you can look at it and say, I know what plant that came from, or I know what grain that came from.
okay.
If it's in a box or a bag or a package, you know, you look at that loaf of bread, do you know what it came from? Or you look at that package of Cheetos. So that's the general rule. The general rule is shop on the edges of the grocery store. You should never, ever, ever need to go into any of the middle of it.
Right.
It should just be on the edges, and where the bulk section is, and where the produce is, and where the eggs and, you know, clean meats are, the organic meats, and you know
So as
that.
long as I'm eating organic, I'm okay. It's okay if somebody else chopped it up and put it in.
Sure. Yeah, I mean, it's not perfect. It's not like the best,
I mean,
but
but,
right, it'd
you
be
know,
best if you went and just you came out in your
Picked it
garden,
up.
put your feet in the earth, and then
Yeah,
pulled
well,
out
maybe
that.
the deer ate my whole garden.
Yeah. That's
They
the
got all
best.
the good stuff, not me.
Yeah, that's the best way to do it. But
Especially
that's
with the
not.
Yeah, okay.
Yeah. What other questions are there out there? Okay.
I just have a comment. When you were talking about causes
Yeah.
or triggers,
Yeah.
just my own personal observation, pregnancy and childbirth and all the hormonal changes that happen,
Yeah.
birth control pills, could those be?
Well, birth control dramatically impacts the immune system. When I see a patient who comes in on birth control pills, we definitely spend some time on it and see Is that absolutely a necessary therapy for you? Can we talk about different approaches? Because it can be a big problem on a lot of levels, not just autoimmune. And I do see health conditions develop in a very small subset of patients around major hormonal fluxes in someone's life. And again, that kind of goes to that predisposition piece. Like, some of us came into the world with this predisposition to have a vulnerability around the hormone mediation of our health. And so, yeah, I see some of those patients, and our understanding and awareness of how to regulate their hormones is part of the conversation, for sure. But autoimmune processes, sometimes they will pick up during pregnancy, and it's uncommon, but it can happen. Yeah.
Hashimoto's.
Yeah.
Will you be
Yeah, I'll touch base about Hashimoto's. So I just, out of respect for people's time, I'm going to go over the individual autoimmune questions and then these ones. So if you need to scoot, thanks for coming. And I have some cards in the back, a little bit about our clinic. They might be gone, but obviously easy to reach out to our staff to learn more about us. And thanks for being here. So for those who want to stay, you said Hashimoto's. Okay. So Hashimoto's is kind of an interesting one. Because the treatment for Hashimoto's is thyroid hormone versus immunosuppressive agents, right? But what Hashimoto's...
Wait till people leave so I can hear you.
Oh, sure, yeah. Thanks, you guys. What Hashimoto's is a autoimmune response to thyroid cells. So basically, the thyroid tissue ends up, if that autoimmune process goes on and on, the thyroid tissues end up becoming destroyed. And so the thyroid hormone is a critical part of us being alive. We have to have thyroid hormone. So the treatment for it is replacing thyroid hormone. It's kind of like type 1 diabetes, similar type of treatment. Type 1 diabetes, the immune system's attacking our pancreatic cells that make insulin, and the treatment for it is to give insulin. So for the treatment for Hashimoto's thyroid disease is give insulin, or give thyroid hormone. And in doing that, one of the interesting things we see is that it actually diminishes the autoimmune activity. So I think part of that is because those thyroid cells stop being active, because now we're replacing function with exogenous thyroid. And so you can actually, like in diabetes, you can preserve some of the thyroid tissue by giving thyroid hormone. I don't agree per se with the conventional knee-jerk to always give synthetic thyroid, because the thyroid gland makes T3 and T4, and conventional doctors only give synthetic T4 because they can convert between each other. But to me, it's always about, let's find out how to copy nature. So I usually just prescribe thyroid that's a T3, T4 combination. But one of the viable treatments that I will employ too is, if I diagnose someone with Hashimoto's, I check their antibodies, they're elevated, I give them thyroid hormone. And then we start doing the work of getting to the root causes of the inflammation and challenges associated with that. And they're going to feel a heck of a lot better when you give them thyroid hormone, because oftentimes their thyroid hormone levels are plummeted as a result of the autoimmune process.
I'm sorry, I have been on thyroid medications for years.
Yeah.
I think I actually finally have found someone who can do it right. I don't know, but I'm getting T3 and T4, levothyroxine and
Liothyronine.
whatever.
Yeah, you're getting two
so-
synthetics prescribed.
So those are two synthetics, but there is like something real I could be taking instead.
Yeah, Naturopathik, Armor Thyroid. We use Naturopathik because it's much more standardized, and the adjuvants or the kind of fillers are way cleaner than Armor. Most conventional doctors will prescribe Armor.
Yeah, and Armor got hard to get. It was impossible to get for a period of time.
Yeah, and right now we're having a crisis around all natural thyroid, which is really sad. And I wonder if there's any conspiracy behind that. But it's a major nationwide sourcing issue right now, and yeah, it's pretty scary because I have a lot of patients on it.
So you can't really get it now either?
Well, there's a supply issue.
Oh, I
It's
see.
not that you can't get it, it's just that right now, there's a really severe supply issue like I've never seen in my career, so, yeah. So did you have more to?
Well,
So, you know, thyroid treatments, I mean, again, D and fish oil are things we may consider. Gut dynamics, nutrition, I mean, I sometimes like to give thyroid precursors, selenium, tyrosine. I really like medical or food-based forms of iodine. I don't give whopping doses of iodine, but I will give the herb, the plant fucus, which is a seaweed that's very good iodine content, can often help. And, you know, I've seen Hashimoto's resolve, not often, but it can. And again, the question there is if you catch it early enough and you can stop the inflammatory process, you can halt the destruction of the gland, and then it can come fully back online. But oftentimes there's been enough destruction where we need to supplement thyroid hormone for the rest of someone's life. You know? And that's not harmful, especially if you modulate the autoimmune process. You can, I have people on who have Hashimoto's that are on a 30 milligram dose, which is very small, for like, you know, their whole life. They've never changed. We check their thyroid once a year, it's always good. We check the antibodies, they're nice and low. You know, so I consider that as close as you can to permanent remission. When it's jumping around a lot, which I see with Hashimoto's, yeah, the causes of the autoimmune process are being pushed. Stress or gut dynamics, that kind of thing. Yeah, so that's a different story. I mean, there's things to do about that. Yeah, in the back.
Just so some sources of natural iodine, I mean, is that primarily fish, but what do you tell patients?
Yeah,
Can we use
well,
seafood?
iodized salt, you know, there's iodized salt, that's most standard, but usually when you're using high quality Celtic sea salts and stuff, they don't have a lot of iodine. Some nuts and seeds have iodine, a little bit in leafy greens, certainly seafoods, specifically sea plants are very rich in iodine from a food standpoint.
So just like dulse and stuff like that?
Yeah.
seafood.
Yeah, Monica, that would be a good thing to like once a week have a little nori or something or in your diet.
How about supplements, like kelp supplements?
Yeah, so that's what I was mentioning, the plant fucus, Fucus vesicatoria, F-U-C-U-S.
Okay.
Yeah, it's a really good one. I use a lot of fucus with my patients. I don't like the big whopping like 12 milligram, 10,000% of your daily value or 50,000% of your daily value. That has the risk to actually suppress the thyroid, especially with autoimmune. Yeah.
Is
Yeah.
there a brand of selenium that would be good? Oh, I'm sorry. I'm just.
It's okay. Yeah, I mean, you know, not really brands, not that important with selenium. It's usually 200 micrograms. You can get it in formulas with other thyroid constructive things. But Larry?
I take nori every day.
Yeah. That's okay. Yeah, I mean, you can take it every day. I was just thinking for someone who's not like actively trying to treat hypothyroid, I mean, to make sure you have enough iodine, yeah, a little bit of seaweed. But that's plenty of iodine you're getting, you know, in that. I mean, you probably don't need it every day. But I don't think it's going to hurt you too much to take it every day either.
Are
Yeah.
hypothyroid and Hashimoto's the same?
No.
No.
No, it's a good distinction. So the most common cause of hypothyroid in the United States is autoimmune Hashimoto's thyroid. But many people do not have Hashimoto's who are hypothyroid. And the thing that my speculation, the biggest with that is devitalized foods, not getting iodine content we need, but probably more prominent is things that displace iodine. So we all know that all the lovely water we drink has fluoride in it. Or sorry, chloride in it. Not all of it has fluoride. We actually don't have fluoride here in Coeur d'Alene. But chloride, or chlorine, is a halogen, and so is iodine. So in the periodic table, chloride is just as reactive as iodine. It's in fact more reactive. So it very easily displaces iodine in the body. So we absorb it through the skin when we shower, we drink water. We're drinking a bunch of chlorine. And so we're displacing iodine. If the water's fluoridated, we have now another source. If we're exposed to radiation, which there is plenty of that in the world, including what happened in Fukushima, there's another source of iodine displacement. So that's a big thing to me, and I think, again, nutrient depletion and not getting all the precursors for the thyroid gland. And on a more, I guess, metaphorical or kind of psycho-emotional level, thyroid gland is the 5th chakra. It's where our voice comes from, and I think a lot of people, there's a big issue there in terms of being able to speak our truth. And so I don't think it's completely unrelated that that is part of what creates thyroid problems for people, as just a few speculations. But yeah, I see a lot of people that don't have Hashimoto's that are hypothyroid. Yeah.
That's just like, I was hyperthyroid and I also got Graves.
Yeah, Graves is another autoimmune.
Right,
Yeah.
okay. And
Yeah.
then I went the whole gambit and I ended up with Hashimoto's.
Yeah, yeah.
And they ended up taking everything.
Yeah, so that in that case, yeah, it's pretty straightforward what the treatment is. It's, it's
I'm gonna have to.
thyroid hormone, but also, again, by just plucking out your thyroid gland, we didn't treat the cause, so
Right.
potentially those causative forces are still impacting health in other ways, and we want to seek to understand those and see how to, still address that.
Okay.
And what's the name of the thing in the antibacterial soap that we absorb that affects our thyroid? I can't remember the name of the compound.
I don't know either, yeah, the name of it.
Yeah, because it's
Yeah.
it's really bad for our thyroid, and I
Yeah.
cannot remember the name of it right now off the top
Yeah.
of my head. But they're so bad for us, the antibacterial soaps.
I kind of like the Dr. Bronner stuff. That's what we have at the clinic. It's cheap and you can dilute it with some water, and it's very, very clean.
And it's just sing the happy birthday song as you wash your hands.
Sure,
That's
sure.
all you have to do.
Yeah. Okay, are we good with thyroid? Are there other autoimmune conditions that we want to kind of talk a little bit more specific about? Yeah.
What are your thoughts? Everybody has their own theory. Or what are your thoughts or experience? Lyme disease. Is there an autoimmune connection there?
The thread that I would draw with it is that Lyme disease is often manifested in a person with a very dysregulated immune system. Do I think that Lyme is an autoimmune process? I think it can lead to an autoimmune process, and I think it can be a kind of co-infection, not co-infection, but side-by-side process going on. But do I see Lyme as an autoimmune process? No. I think it has to do with terrain and the concept that someone's terrain is vulnerable to the Lyme in the moment where they have the exposure, and then the Lyme is able to establish itself and begin to manifest dysfunction in the body, and the immune system is not able to clear it. So when I treat Lyme, well, I'll use some antimicrobials to go after the bug. I'm much more focused on the same concept of this autoimmune lecture on identifying what is encumbering the immune system or distracting it from addressing the Lyme vector, the Lyme microbe. And I have some pretty good success in that realm. If someone is really chronic Lyme and they're very debilitated and degenerated, it takes a long time. And I like to usually work in teams in that setting. But I'm not a big fan of having people take months and months of antibiotics, although some people have been cured. And, that's, again, I'm just speaking to what my passion is and what is how I see health and how to engage with it. But everyone has their own way. Conventional doctors, other naturopaths, chiropractors that can be very effective and powerful for their patients. So there's other ways to do it too. In the back, yeah.
About psoriasis?
Yeah, psoriasis. Good one. The gut issue is a big deal with psoriasis. So I particularly find that engaging with understanding food intolerances is critical there, and I specifically feel that oftentimes, especially when the person's an A blood type, but even regardless, really poor qualities and too much meat consumption can be a big player there. I really like vitamin D therapeutic levels of D for psoriasis, and I'll actually use it topically too, with an herb called neem. It seems to do pretty well, and I really like to use activated B vitamins and folic acid to help the skin convert into healthier tissue, because those vitamins are very critical in the cell turnover process, right? Because psoriasis cells turn over very rapidly.
What's activated B, is that orally?
Yeah, just B vitamins that are activated. There's specific forms of Bs. Yeah. Yeah. What else? What other processes? Yep.
My daughter just recently had her knees just swelled up for no reason. And they tested her for rheumatoid, and they said, no, it's not that. But then they went to someone else, to another specialist, and some test they did said it's either atypical lupus or atypical rheumatoid.
Sure.
And so they said they don't really know at this point because it's so new.
Yeah.
So they just put her on this medication that would take care of either one.
Suppress the inflammation. Yeah.
But what would you recommend, just to, if it's either one of those?
Yeah. Well, again, engaging with all the underlying forces, as we talked about, engaging with gut dynamics, sources of inflammation, kind of understanding how she responds to stress, and if that is a factor in what creates her well-being.
And her blood type's O.
And blood type O, so I would be engaging in the realm of gut dynamics with starting there and understanding food choices and what's appropriate. Rheumatoid, those anti-inflammatory nutrients I have a lot of success with, so the therapeutic grades of fish oil, the forms of curcumin that are really good there to help mitigate the inflammatory process would be pretty good starting points, I would say.
And she is newly pregnant, and her dad has MS, and her grandma has rheumatoid.
Yeah, so big genetic setup.
Yeah.
Yep, so the vulnerability is there. So again, that doesn't mean that there's a lifelong kind of guarantee of battling that autoimmune process, but it does mean that it's an opportunity to gain deeper self-knowledge and be aware of the forces that impact well-being. And I think of, I see people in my job that are suffering tremendously. And why would we suffer? I mean, if it isn't for a higher power or a God, would it just make us all suffer? It's to create an opportunity to help us understand and learn about how to better be in alignment with ourselves and get to a place of balance in our lives. And so, it's a very traumatic thing to learn, but it's also an opportunity to really create transformation in one's life. And I've seen that happen so many countless times in my practice of people who were given these very grave diagnoses, and yet that was the catalyst to completely change their life in a very, very positive direction. So, that's kind of a way to talk with your daughter maybe about that, is that, especially when she feels like there are things she can do versus taking drugs, I mean, that she could be empowered in her healing process. I think that's a really good way to help reframe perspective. Not that it's easy work, but it can definitely, get her into a better place of not feeling so helpless, especially being pregnant and very vulnerable with that. Yeah.
Maybe I should just say that my husband here wasn't fully diagnosed with RA, but every time we